Today, we're diving into a really fascinating news study out of Karachi, Pakistan. It peels back the layers on something that affects millions of lives: the quality of family planning services. And really, it's a story of one city, 6 clinics, and a powerful lesson in what happens when we actually start listening to patients. Think about this for a second. Is all healthcare created equal? I mean, when you walk into a clinic, are you getting the exact same level of care as someone in a totally different neighborhood? It seems like a simple question, right? But the answer is, well, it's pretty complex. And that's exactly what we're going to explore today. Okay, so to really get why this study is such a big deal, we first need to understand the bigger picture in Pakistan. You see, family planning isn't just a personal choice, it's a massive piece of the entire national health puzzle. Get this number in your head: 20%. In Pakistan, 20% of couples have what experts call an unmet need for family planning. What that means is they want to space out their kids, or maybe limit the size of their family, but they're not using any form of contraception. That's a huge gap, and it represents millions of families whose needs just aren't being met. And here's the other side of that coin. A pretty staggering 37% of women who do start using contraception stop within the first year. So why? Well, it often comes down to health concerns or just being really dissatisfied with the service they got. It's like a revolving door that leaves families feeling vulnerable. So when you put those two numbers together, a really clear picture starts to form. It's not just about whether you can get to a clinic. It's about the quality of the care you get when you're there. A bad experience can have these long-lasting effects, becoming a major roadblock to a woman's health and her family's future. So to get to the bottom of what was really happening, a team of researchers decided to go straight to the source. They talked to the clients themselves. They set out to just listen to the experiences of 600 women. And that brings us to this brand new study, authored by JoWaCH Shamsi, Rana Saba Sultan, and Ambreen Fazal. It was just published in the Journal of Women and Child Health, and their work gives us this incredible, unprecedented look into the private healthcare sector in Karachi. So how'd they do it? Well, their method was actually pretty straightforward, but really powerful. The researchers went to 6 different private family planning clinics all across the city. As women were leaving their appointments, they were invited for a quick, confidential interview. Each of the 600 women was asked a simple question. On a scale of 0 to 10, how satisfied were you? Then the team took all that data and started looking for patterns. And what they found, well, it was really a tale of 2 completely different experiences. At first glance, things looked great, overwhelmingly positive even. But when they started digging into the data from each individual clinic, a much more complicated story emerged. Let's start with the good news, because there is good news. Overall, a huge 89% of the women said they were highly satisfied with their care. They gave it a score somewhere between an 8 and a 10. And that suggests that, on the whole, these private clinics in Karachi are doing a pretty decent job.
But, and this is a big but,
was that high satisfaction the same everywhere? Did a woman get the same quality of care no matter which clinic's door she walked through? The data basically screamed, absolutely not. Okay, so check this out. Let's look at the clinic in the DHI neighborhood. The results here were just astounding, 100%. Every single woman they interviewed gave the service a perfect 10 out of 10. This shows that, this amazing top-tier service, it's not just a dream. It's actually achievable. Now let's compare that to the clinic in Korangi. Wow, the difference is just night and day. I mean, sure, a lot of clients were still satisfied, but their experience was all over the map. Almost 1 in 10 women gave a super low score, like a 4. The ratings were just much more inconsistent. This table really puts that gap in sharp focus. On the left, you've got the DHA clinic, 100% perfect scores. On the right, Korangi, where only 18% gave a perfect 10. But now, look at those bottom rows. This is crucial. The demographics are completely different. The DHA clinic was serving a wealthier, more educated group of women. The Korangi clinic, on the other hand, was serving a community with much lower income and education levels. The data is telling us a powerful story here. A woman's experience was tied not just to the clinic, but to her socioeconomic background. And listen, this wasn't just a coincidence or a fluke. The researchers ran all the numbers, and the difference in satisfaction between a clinic like DHA and one like Korangi was what they call statistically significant. In plain English, that just means this huge gap in care is a real, measurable problem. It's not just random chance. So, the big question is, what can we do about it? Well, The good news is that the study doesn't just point out a problem, it actually points towards a solution. It gives us a kind of blueprint for how to improve the quality of care for everybody. The path forward really boils down to 4 key steps. First, you've got to learn from the best. Figure out what makes clinics like DHA so successful, and then copy that playbook. Second, give clinics like Korangi targeted support and training to help them with their specific challenges. Third, make listening to patients a standard part of the process. Monitor client satisfaction all the time. And finally, you gotta recognize that one size doesn't fit all. Services have to be tailored to what different communities actually need. All right, so let's zoom out for a second. Why does one study in one city really matter in the grand scheme of things? Well, because it gives us this powerful model for understanding and improving public health everywhere. We kind of already knew that quality of care was important, right? But most of the research in Pakistan focused on the public sector. What this study adds is hard, concrete proof of these huge differences in quality within the private sector, which is growing fast. It takes us from a general feeling that quality varies to solid data that says, look, here is exactly where the problem is, and by the way, here's a model of what excellence looks like. And this is why it all matters so much. This isn't just about getting a good score on a survey. Better, more respectful care directly leads to better health outcomes. Women are more likely to stick with contraception, which means fewer unintended pregnancies, safer births, and healthier, stronger families all around. Ultimately, this study from Karachi, it's not just about Karachi. It's a powerful reminder of a universal truth. Healthcare gets better when we listen. The data shows us where we're falling short, but it also shows us a path to excellence. And that leaves us with one last big question. What could change in our own communities and all around the world if every single health system made it a top priority to truly, genuinely listen to its patients?